We have seen a rapid rise in flu cases over the past few months in several states of India. The topic of today is influenza, also known as flu. India generally witnesses two periodic episodes of flu, one from the period of January to March and the other in the post-monsoon period. So I'll be discussing this topic under these headings: a basic knowledge about influenza, why is it that flu outbreaks occur every once in a while, symptoms of the disease, and proper precautions that you can take to prevent them from happening. Now, influenza is caused by a group of virus called myxovirus. Now, the term myxo means mucus, or in medical terms, we can say mucoprotein. So, relevance? Relevance is that the virus has receptors which bind to the mucoproteins of the human host cells. So, there are three types of influenza viruses: A, B, and C. Of these three types, only the type A causes the outbreaks of influenza. Now, you'll often find news channels using the terms like influenza outbreaks H3N2, H5N1. Sounds like Hebrew, right? Well, not anymore. These terms, these numbers, these letters actually mean the strain of the influenza virus that is causing the disease. So, influenza A has generally has one H strain and one N strain, right? Now, the types of H strain that cause disease to humans are 1, 2, 3, 5, and 7. And for N, it is 1 and 2. So, whatever strain, whatever combination you'll see will generally be the permutation and combination of these numbers. In rare cases, the virus does not maintain these permutations and the numbers may vary. Now, why does that occur? How does that occur? I'll explain in a bit. So, how does this virus spread? Aquatic birds are a major reservoir for this virus. Reservoir? What is reservoir? Reservoir, in medical terms, actually means the virus can reside inside the host cell without causing any significant damage or harm to these animals. So, aquatic birds have the virus inside them, but they don't experience any symptoms or any disease or any illness. Now, from these aquatic birds, through their secretions, through other contaminations, these viruses spread to pigs or poultry animals, right? And from their respiratory secretions of these pigs or poultry animals, the virus gets to us, the humans. Now, what happens inside the pig cell is very interesting. The pig acts as a mixing vessel. So, for example, if there are two strains of this influenza virus getting inside the pig cell, during the replication process, there are exchange of RNA segments. In medical terms, we say it is as gene reassortment, right? So if there's strain 1 and strain 2, these two mix with each other and create a new strain, which no one has ever heard of. Now, if no one has ever heard of this strain, practically there is no vaccines available for this. And hence, it spreads massively, creating pandemics, epidemics. So in these rare cases, these permutations don't work, right? Like it might be H4, right? What numbers did I tell you? 1, 2, 3, 5, and 7. So suppose H1 and H3 gets inside the pig cell, it might create a new strain like H4, which no one has ever heard of. Now that creates a big problem. Now, once the virus gets inside humans, between us, it spreads through, again, droplets, respiratory droplets, like when we cough, when we sneeze, contaminated doorknobs, clothes, right? Now, the question that naturally arises in our minds is, if the disease is so much prevalent, if it is occurring every now and then, every year, biannually. Why is it that there are no medicines available? Why is it there are no vaccines available? Are the scientists just gossiping and sitting over a cup of coffee? The answer is no. There is a very good reason why there are no medicines, no vaccines available for this, for targeting exactly the strain of the virus. The answer lies in two terms: antigenic drift and antigenic shift. Now, the antigenic drift part usually refers to slow mutations in the strain, in the antigenic strain. So there are point mutations occurring in the RNA strain, and that is why the virus keeps mutating to a slow extent, a minimum extent, right? And this gives rise to periodic epidemics. The antigenic shift, on the other hand, means there is sudden massive change in the antigenic strain, like the gene reassortments that I talked about earlier. Now, these antigenic shifts gives rise to massive pandemics and epidemics. So, as you can see, if the gene keeps changing, if the strain keeps changing, you can't produce medicines or vaccines to target these changing strains. There is nothing constant here. Now you might ask, so are there no medicines the doctor might can give me to make me feel better? Yes, there are medicines that target the symptoms. Like if you have fever, then doctor might give you antipyretic drugs. If you have cough, the doctor might target the coughing. But as of now, there are no medicines or specific vaccines that can target the influenza virus as a whole, right? For example, in case of HIV or AIDS, we have vaccines. In case of rabies, we have vaccines that target the virus, that target the pathogen, right? But here, as you can see, the strain keeps on changing, so there cannot be any vaccine or medicine that can exactly target the strain. Now, coming to the symptoms of this viral disease, we can start off with headache, high-grade fever, coughing, vomiting, extreme tiredness, joint pains, muscle pains, runny nose. It can be runny, it can be stuffy, right? Sore throat. Yeah, that actually sums it up. Now, which group of people should be extra careful for this viral infection? Old people, people more than 65 years of age, people with chronic diseases like with a history of chronic lung, chronic liver, chronic kidney diseases, pregnant females, obese people, people with heart diseases, in any condition where there is compromisation of the immune system, like in HIV infection or people having hepatitis B infections. Now, why is it that these people, need to be careful? You'll say it's just a virus, it's just a viral fever. Well, in these cases, there might be complications that will be arising from this viral fever, and it will not be just a fever. The people, aforementioned group of people, might develop pneumonia, ear infections. In medical terms, we say it is otitis media, for the medical term for ear infections. Several heart problems, several nervous problems like encephalitis, Ray's syndrome, and acute bronchiolitis or croup. Now, what is it? What is croup? It is actually a lung disease occurring mostly in children actually. Details of encephalitis or croup or Ray's syndrome, if you want to know, please pin down in the comments. I'll make a separate video for that. Prevention of this disease can be done using proper precautions like proper hand washing techniques, proper hand drying. There are actually an 8 or 9 step procedure for proper hand washing as advised by CDC. I'll take that up in an upcoming video. Like, so proper hand washing, proper hand drying, use of N95 masks, hand sanitizers, covering your face, covering your nose while coughing, so that it does not spread to people around you. Avoid close contact with ill people. Avoid touching your eyes, mouth and nose every now and then. Lastly, I need you to keep in mind that COVID and flu, they have quite similar symptoms. Whereas COVID, on the other hand, has far more severe outcomes, consequences in the long run. So if you are having such symptoms, please go to your doctor, get yourself checked, and stay safe, I guess. That's it for today. I hope you understood and liked the video. If you have any kind of doubts, the comment section is all yours. See you in the next video. Thank you.